Hello and welcome to Pace Hospital's podcast. Today we are shedding light on an important and often misunderstood topic, that is ectopic pregnancy. Joining us today, Dr. Mugdha, Obstetrician, Gynaecologist, Laparoscopic Surgeon, and Infertility Consultant with extensive experience in diagnosing and managing complex gynecological conditions. In this episode, Dr. Mugdha will guide us through the causes, symptoms, types, diagnosis, and treatment options of ectopic pregnancy, while also discussing the emotional and physical impact it can have on individuals and families. So, whether you are a medical professional, a patient, or simply someone looking to understand this condition better, stay tuned for a valuable and informative conversation. Thank you, Dr. Mugdha, for joining us at Pace Hospital's Hitech City. Let's start by understanding what is ectopic pregnancy.
Any pregnancy outside endometrial cavity is called as an ectopic pregnancy, outside the uterus. So it can be inside the uterus, but maybe in the cesarean scar or near the corners or even in the cervix. Any pregnancy outside, like in the tubes or in the ovaries or anywhere in the extraperitoneal or intraperitoneal. So that is generally any pregnancy normal outside the normal endometrial line.
So, doctor, what are the causes of ectopic pregnancy?
The most common cause is pelvic inflammatory disease. Basically, we are referring to self-injectings. Now, what is self-injectings? Generally, in normal people, and fallopian tube is lined by cilia-like structure which is helping in the peristalsis. That is, it is helping eggs to pass inside the uterus. Whenever in patients of self-injectees, these hair-like structures are not working or they are damaged due to the infection. So what happens, the eggs which will come and stay in the tube, when they get fertilized, they are not able to go inside the uterus, and many of the times it will stay there only and lead to ectopic pregnancy. Then other causes like failure of contraceptive devices, like for example intrauterine device. In that, many times because of any failure reasons, it can lead to ectopic pregnancies. Other than that, progesterone only pills. If you are taking progesterone only pills once in a while, there are rare possibilities that because it will lead to disturbance in the tubular motility, there can be ectopic pregnancy chance. The others can be failure of contraception, like in case when you have underwent sometimes in family planning surgery. In that cases, there is a risk of reepithelialization, because of which again a tubal ectopic can happen. Even intrauterine devices might lead to ectopic pregnancy. Sometimes while receiving infertility treatment, because of unknown reasons, there can be a risk of ectopic pregnancy. Other than that, prior abortions, because of which you could have had some infections which might ascend and lead to any ectopic pregnancy. Also, some reconstructive surgeries done for the tubes, or any time if there are some pelvic adhesions which might lead to ectopic pregnancy. Even if you have any developmental defects like elongation of tubes or at times any problem, that also lead to ectopic pregnancy.
Dr. Mugdha, what are the risk factors of ectopic pregnancy?
These days there is increased infertility, because of which the treatment for infertility is also increased. Now, in this cases, there is increased risk of ectopic also. So the other reasons are more sexually transmitted infections and more pelvic inflammatory diseases. Also, more sexual partners is also a very important reason for having ectopic pregnancy.
Could you explain who are at high risk for ectopic pregnancy?
So, first of all, multiple sexual partner. It is very important reason of you getting pelvic inflammatory disease and vice versa. Also, increased incidence of infertility, because of which the number of infertility treatment has increased, and so the incidence of this ectopic has also increased. Also, the increase in the rate of sexually transmitted infections, because of which also there is increase in the incidence of ectopic pregnancy.
Can you explain what are the types of ectopic pregnancy?
So basically, we can broadly classify into three types: acute, which is ruptured ectopic pregnancy, or unruptured ectopic pregnancy, and chronic or old ectopic pregnancy. Ruptured or acute ectopic pregnancy is in which generally the tube, or for example, wherever it is pregnancy is there, that part. Basically, we are referring to tubal pregnancy because it's a 90% chances of tubal pregnancy only, and the other pregnancies are there. So we will talk about tubal pregnancies only mostly. So tubal pregnancy, when it is ruptured, is when the tube has ruptured and the pregnancy is tried to come out, and in that case there is excessively bleeding, because of which the patient presents in acute conditions. So that is why it is called as ruptured ectopic pregnancy. So unruptured ectopic pregnancy is in which the pregnancy is still inside the tube and there is no bleeding or anything which is starting in the abdomen, and the patients might just present with a missed period or even in early pregnancies. Chronic or old ectopic pregnancies are the pregnancies in which the patient has already taken the treatment which has succeeded, or even sometimes acute pain might have happened to the patient, but with time it has subsided, and now the patient comes with a prolonged amenorrhea, that is no periods for a long time.
So, doctor, what are the symptoms of ectopic pregnancy?
This pregnancy patients come with acute symptoms like pain in the abdomen in 100% of patients. Some patients also have amenorrhea, which is at least 45 to 60 days of last periods, or sometimes they even come with a regular period, but the first period might be just like a spotting, or another symptom is vaginal bleeding. They might have started getting brownish discharge per vagina, which is also one of the symptom of ruptured ectopic pregnancy. But the main reason is pain in abdomen. Okay, severe excruciating pain, even pain in the chest. It can be irritation of diaphragm, that is excruciating. It causes excruciating pain in chest. These patients generally present with similar symptoms. They have pregnancy-like symptoms. Also, they have delayed periods. Sometimes spotting might be there, some brownish discharge. Also, a colicky type of pain which comes and go, or a pain which is like molding pain in the abdomen. Sometimes they come with a vaginal discharge. So these symptoms can be there in unruptured pregnancy. Chronic or old ectopic pregnancy, generally these patients come with fever, some dull aching pain, sometimes even retention of urine or increase in the frequency of urine. Fever, why? Because there is a risk of infection because of prolonged ectopic, and also they present with a pain which was there in the past, like excruciating pain, but now it has settled down and now they have dull aching pain, and sometimes brownish discharge per vagina. These all symptoms might be there in chronic ectopic pregnancy.
So, doctor, what are the diagnostic tests for ectopic pregnancy?
Basically, any unmarried, married patient, sexually active female coming to us with a history of all this, as I said, with pain in abdomen, all these findings, whichever we just discussed. Other than that, we do a beta HCG test to confirm there is pregnancy, and other than that, an ultrasound abdomen pelvis would be enough to diagnose ectopic pregnancy. Or in some cases, in some unknown cases, we also go for laparoscopy, in which we can even intervene the pregnancy if needed. Any female in the age group of 20 to 35 years presenting with excruciating abdominal pain, or any pain with the missed period or brownish vaginal discharge, with a history of unprotected intercourse or even protected intercourse, even in some cases of regular periods also. Any patients with pain in abdomen, first we do is beta HCG. Beta HCG at least rules out if there is pregnancy, and also abdomen pelvis scan. In cases where there is excruciating pain, like in ruptured pregnancy, in that there is no time to waste. It's a indication to directly go for laparoscopy and remove the tube as well as remove the pregnancy.
So, doctor, what is the treatment of ectopic pregnancy?
In rupture ectopic pregnancy, it's an emergency situation. It's a life-threatening situation because it's like there is like an open tap which is left inside because the pregnancy has ruptured and the tube has started to bleed. So the time we take for surgery is very important. It is very crucial to immediately go for the surgery, as the surgery is laparoscopy, which will be removed. The tube will be removed. That is called as laparoscopy self-injectomy. We will also correct the blood loss by giving blood transfusion and even fluids, that is IV fluids. Treatment of unruptured pregnancy. Unruptured pregnancy has two choice of treatment. First is medical treatment, and so another one is definitely surgical treatment. So medical treatment depends on some values, that is beta HCG value. We check for beta HCG. If it is less than 3000 international unit, we can think of opting for medical treatment. In that case, we give some drugs. Also, USG findings are very important. USG findings is in which GSAC is less than 4 centimeter, the fetal heart has not yet formed, or there is no signs and symptoms of any bleeding in the abdomen. In that case, we can give a medical trial. In that, we give some injections and we do a serial evaluation of beta HCG. If it is decreasing with the dates we tell you to do, in that case, we can continue with medical termination of ectopic pregnancy. Then surgical termination. Surgical has two options, that is self-ingostomy and self-injectomy. In self-injectomy, we remove the tube along with the pregnancy, and in self-ingostomy, a tube is pregnancy is just taken out from the tube, and the tube is kept as it is. But but there is a risk of repeated ectopic in the same tube because of any damaged epithelium, any damaged cilia that we were discussing before. Treatment of chronic or old ectopic pregnancy. So first of all, correction of any infection factor, correction by giving some antibiotics and fluids if needed, and then removal of the tube which has pregnancy along with the pregnancy.
Can you explain what are the complications of ectopic pregnancy?
In cases of ruptured ectopic pregnancy, it's a very emergency and life-threatening situation. In that case, because of bleeding in the abdomen and the blood loss, there is a lot of bleeding in the abdomen, which can cause definitely pain. Patient can end up in shock, and it can lead to mortality also. In cases of unruptured pregnancy, if the pregnancy is resolved, that is a good thing. Or might lead to again rupture eventually by the growing pregnancy, or in some cases, if the pregnancy is not completely gone, it might lead to a chronic or old ectopic pregnancy.
Is ectopic pregnancy a life-threatening situation?
Yes, even in ruptured or in unruptured ectopic pregnancy, both can be an emergency situation, because an unruptured pregnancy might rupture with the growth of the pregnancy, or there can be any infections, and because of which also it can definitely rupture and cause emergency conditions. In cases of ruptured pregnancy, since there is bleeding in the abdomen, there is blood loss, patient might go into shock or even mortality.
Can babies survive in ectopic pregnancy?
So, as we were discussing, ectopic pregnancy is not a pregnancy which is in the normal uterine cavity. It is anywhere outside that. So, anywhere outside that, like for most commonly, it is in the tubes. In the tube, there is no place. You imagine tube is like a refill, That much place can definitely not occupy a baby, and it cannot slide down by itself and come in the uterus. So, definitely, ectopic pregnancy cannot survive.
One of the most frequently asked questions we received is, can an ectopic pregnancy resolve on its own?
So rare, but yes, in case if it is unruptured pregnancy with the beta HCG less than 1000 international unit, and in the ultrasound if there is no signs and symptoms of any bleeding, in that case that's like an expectant management we do for an unruptured pregnancy. In that case, we just observe with the serial beta HCG value to see if the beta HCG value is coming down. In that case, it might be resolved on its own. Otherwise, there is very less chances of it going on its own.
Does beta HCG increase in ectopic pregnancy?
Yes, it increases in ectopic pregnancy, but the increase is not like the increase in normal pregnancy. In normal pregnancy, it doubles in 48 to 72 hours, but in ectopic pregnancy, it does not double in 24 to 48 to 72 hours. It just increases slowly, slow by. It's not corresponding to the value of missed period or the gestation sac.
So, doctor, can an ectopic pregnancy be mistaken for a cyst?
Yes, an ectopic pregnancy symptoms might be similar to, or a patient might also be mistaken for appendicitis, a ruptured chocolate cyst, or even a corpus luteum cyst, or even an ovarian torsion. Even in cases of perforated peptic ulcer, might present with the similar pain in abdomen and similar complaints.
Dr. Mugdha, is it possible to have an ectopic pregnancy even if you are experiencing regular periods?
Yes, in that case, sometimes, many times, the patients present with a regular cycle, still with a UPT positive, or presenting with pain in abdomen. So, patients do come with a regular cycle. It can be present because since the pregnancy is outside the tube, the bleeding from intrauterine cavity might still happen.
Can pregnancy test kit detect ectopic pregnancy?
So, a pregnancy test kit might show a faint pink positive line or even a dark positive line. Also, but it doesn't confirm the ectopic pregnancy. The confirmation definitely is done by a ultrasound or a laparoscopy only. But even if the UPT is negative, that is, a pregnancy test kit is negative, it doesn't even rule out ectopic.
So, doctor, can ectopic pregnancy change to normal pregnancy?
No, normal pregnancy is inside the uterine cavity, and ectopic pregnancy, that is an outside pregnancy, cannot migrate into the cavity by its own, and so it cannot be converted to normal pregnancy on its own, or neither can we do it by any surgeries. We have to intervene the ectopic pregnancy and plan for a normal pregnancy again.
Dr. Mugdha, can fertility drugs cause ectopic pregnancy?
So it's not because of the infertility treatment, but yes, because of the stimulation given to the ovaries and because of many other reasons, there is risk of ectopic pregnancy due to affected tubal motility because of the drugs.
So, doctor, one final question. Can birth control pills cause ectopic pregnancy?
Yes, it is rare, but yes, birth control pills can cause, especially progesterone only pills. That pills affect the tubal motility, because of which ectopic pregnancy risk increases.
Thank you, Dr. Mugdha, for sharing crucial information regarding the ectopic pregnancy to our listeners. We hope this episode has provided our listeners with valuable insights into ectopic pregnancy. Understanding its symptoms, causes, and treatment options is vital. Early detection can save lives and prevent serious complications. If you or someone you know is experiencing unusual symptoms during early pregnancy, don't delay. Consult a qualified obstetrician or gynecologist immediately. Timely care makes all the difference. We will be back soon with another informative episode right here on Pace Hospital's podcast. Until next time, stay informed, stay vigilant, and prioritize your reproductive health. Thank you for tuning in.